presentation, but really to answer your questions and share what's already being done, but more importantly, to bring up ideas about what else can be done. I hope you felt what we do. We let the science and the data drive our focus. We can't do everything with limited resources and limited staff. And so the science is really important, but even more so, what I've learned from both Dr. Anda and Laura Porter, who I'm happy to say came to our community twice after last April's town hall to train us, gotta find my clicker here, is the science is the aha moment, and the building resilience and promoting hope is what comes from what people individually, within their organization, within their family, their church, their PTA, with the kids that they touch, that's where the resilience comes from. That's where the hope comes from. And we got some examples of other communities that have been doing this a little longer than us, but the time is right. This is our time, this is our tipping point. So Dr. Anda and Laura Porter have created a common language for explaining the ACE study in a way that anybody can understand, to get the neuroscience and DNA changes, but also the hopefulness of what communities, individuals, and organizations can do about it. They call it ACE Interface, and I'm pleased to say there's 26 folks right now in the community that have rolled up their sleeves since last July and has been doing trainings across the community, across the whole county. Raise your hand if you've attended one of our ACE trainings. You're one of the 17,000 folks in 84 presentations that we've reached so far, and we're just getting started. So, and I'm not gonna read everybody's name, but we put the logos so that you can see it's not just your usual suspects. It's not just First 5 and public health and family serving organizations. We had the chief of probation say, I want to send a trainer, and I want the folks in probation and juvenile hall to understand this. We had our brand new DA within the first couple weeks of being on the job agree to send a trainer and embed this type of understanding and science into the work that they do. We have representation from incredible partners here, and I will let you know that once we're good trainers, we have to go through a period of training. We plan to have a second Train the Trainer training. It'll probably be after the first of the year. And so if this is something that you are interested in, you need to get connected to us, and we're going to tell you how you do that. The easiest way is that little card that you got as you walked in, or you can pick up on the way out. Go to our website, shastastrongfamilies.org. And it's not just about training certain folks. I think you heard from Dr. Anda. It's not just the folks in the room, it's the folks who aren't in the room. So far, our 17,000 folks have crossed 6 different spheres, what we call spheres of influence, because we know when these gears all start working together in a community that has a very high ACE scores like ours, 40% of the adults surveyed, that is where you start to see change happen. That is where the generational cycles of ACEs start to be broken. So if you are connected in any way, and I know you all are, to one or more of these spheres, you need to help us tell everybody we know about ACEs and then start to work within our spheres of influences. We did a 2-day training with Laura Porter and Dr. Anda, and what they kept coming back to, you can have a million different strategies, but it starts with telling everyone you know about the science and then looking at how we can work within our sphere. And our sphere can be 6 people in your living room that you want to host an ACE training. It can be your Rotary, it can be your entire organization, it can be a church group, it can be anything. We've got those 26 trainers ready to get out there. So let us know. And how you're going to do that is you're really going to get involved in this movement. We all have a lot of things we could have been doing tonight. Many of us after a long day at work. I understand it's family night at the rodeo, and you're here, not there, so thank you. So getting involved means many, many things. This is just a small sample of what you can do when you walk out of here tonight, and it's all on the back of that little card that you were handed. First of all, if you haven't gone to the full hour-and-a-half training developed by Dr. Anda and Laura Porter, please go to the website and figure out a way to either host one or attend one. First Five has one every other month, so that gets in your schedule. But public health staff are there to navigate you and connect you with the training or to help you organize and host one. If you know people that need to see this movie, help us connect to them. We wanted this to be our big public launch, but we have bought the rights for the DVD for at least another 9 showings, and if we use all of those, we'll just go back and buy another, and another, and another. We're looking for groups of maybe 40, 50, 60, where we can end it with a really good discussion. But if your group isn't that big, still let us know, and we might couple you with some other groups. But we want to have the movie be spread far and wide across the community. Help us know who to bring it to. Share your story. Every time I do a training, 2 or 3 or 4 people wait till everyone's cleared the room, and they come and tell me their story. If you go to the website, the ShastaStrongFamilies.org, which is the website of the collaborative we mentioned earlier, there's a video on there, and it's the Annette video. If you haven't seen it yet, look at it. That's exactly what we're talking about. Not necessarily the details of what happened to folks, but what happens when people, especially people with high ACEs, learn about ACEs. What can they do next? How has it influenced their life and their work? I really do want to point out that when I showed those slides before, the oil slick slide, you didn't see any of those physical or social issues hitting 100%. And so just think for a minute what that means. Even with 4 ACEs, 6 ACEs, 9 ACEs, not 100% of folks with childhood adversity go on and have those kinds of health issues. It just means your odds are worse. And so it means you might have barriers that you need to overcome, challenges. So this is where the resilience part comes in. But if you can share your story, if you're open to doing that, we would love to hear from you, and there's a confidential way to work with our staff to do that. Parenting came up in the movie as a crucial point, and often when adults do their ACE assessment and they learn about the science, it's when they realize that they've gotten caught in a cycle and they're ready to break that generational cycle. And if they're parents, is there a way that we can bring them in and support them so that they're not passing on these ACEs to their children, or at least not anymore? We have parent cafes supported by the collaborative, coordinated by the Child Abuse Prevention Council. I know many of our collaborative partners, including CAPC and Shasta Head Start, do parenting cafes. Go to the website, find out more. Either you go yourself or bring a friend or a neighbor or family member. And finally, Charlie Menor walked in, and I looked at him because when I first moved here, Charlie was one of the leaders who really talked about developmental assets. And I thought that it was really called out very well in the movie that all children deserve a loving and caring, supportive adult in their life. And we hope that's the people raising them. And in the meantime, how do we make sure that each child has one of those? How do we build those developmental assets? And one of the ways is you can become a mentor. And we have agencies across the county that are doing incredible mentorship programs through our own Reach Higher Shasta Career Connections, through the work of the United Way, Catalyst, YMCA, Youth Violence Prevention Council. There's tons out there. Go to the website and you too can be connected. And now we're going to turn it over to the discussion part. Yeah, that's the end. No more slides. But while we do that and the lights come up and I physically move chairs out here for our guest speakers and we introduce them, I'm going to turn it over to Kelly Keith, the supervisor in the public health branch that is really coordinating a lot of this ACES work, because she has a task for you to do.
If you could put that social media slide up. So how many of you all thought tonight was really powerful? Yeah, I agree. So we have a lot of community members that are really passionate about this work and really dedicated, and we are wanting to capture those stories so we can celebrate the movement of what's going on in our community. So I would like everyone to pull out your phone right now. And I want you to go to your Instagram. That's right. That's right. Because we want to begin to build momentum, and we want you guys to know what is being done around ACES, and we just want to keep building. So I want everyone to go to Shasta Strong Families. We just launched it today, so if you look at the feed, there's only 2 pictures. But we're going to build on that. So everybody follow us. And then you can always, like Terry mentioned, you can always reach out to us as well on our website. So follow us on Instagram, and we look forward to hearing from you.
Thank you, Kelly.
And Kelly also asked me to let you know that if you RSVP'd through Eventbrite, guess what? We have your email, and we'll make sure to stay connected and let you know of all the other new events that are going on in the future. But if you did not, which is just fine, we're glad you're here, please, if you'd like, either go to the website and give us your email, or you can sign up at the desk on the way out so we can stay connected after tonight.
So again, we really hope that you enjoyed this movie, and it really does give me chills every time that I see it, mainly because I think, you know, we're building some knowledge around why people actually maybe behave in certain ways. Not giving them permission to behave in certain ways, but definitely understanding the why, and maybe how we could better approach them. And then maybe how we can better support those families who are raising young children, because, you know, the movie really did point out that when you're a toddler and this is all happening to you, you can't really pull yourself up by the booty straps. And I think that that's a really important point, because as we get older, there's an expectation that you can, but if there's never put anything in place to help you learn those things or to help you figure that out, it's really hard to navigate. So I think it's really important that we remember that. And I think Oprah Winfrey recently, discovered a lot more information about ACEs, and she recently talked about this topic, and she said, you can't build resilience and grit where there's a hole in the soul. You have to address the trauma. And I think for us in our community, we've got to start addressing the trauma in ways that are successful for us, or we're going to continue to go down paths that we're not liking in our community. And I don't know about you, but I love Shasta County, and I want it to be a place that is wonderful for my children to grow up. So with that being said, I want to make sure that we have time for our panelists to come up and join us in discussion. And so if Judy Flores, who is the Shasta County Superintendent of Schools, this is her 32nd year in education, and she is just finishing her first year as our superintendent and doing an amazing, wonderful job. Thank you, Judy. And prior to that, 10 years, she served as the assistant superintendent, so she's very familiar with what's happening in our schools. We also have Dr. Candy Stockton, and she is the director of the Integrated Substance Abuse section of Shasta Community Health Center, and she's board certified with family medicine and addiction medicine, and she's done a long-term health effects of adults raised in families with substance abuse issues. And And last but not least, we have Susie Foster. She is a family nurse practitioner and the Chief Medical Officer for Hill Country Health and Wellness Center. She led the development of Hill Country's Medication-Assisted Treatment Plus program, which utilizes Suboxone in conjunction with behavioral health interventions to help with opiate addiction. Thank you all three very much. And along with them, we will have some of our esteemed members of the committee sometimes answering. And I know that Kelly Rizzi's out there, and she's on the Shasta Strong Families, Collaborative Strengthening Families. That's the website. You know, we just whatever. You know, strong families, strengthening families are all there. It's all the same words, right? No. So we have some of them out there. Did Dr. Deckert get here? Hi, Dr. Deckert may also be fielding some questions in regards to some of the ACEs science, so we just wanted to know where you were. Thank you for being here. And so with that, we'll start off with some questions. Does anyone in the audience have questions? If you raise your hand, please stand so that our microphones can get to you, and then we will have you ask a question, and we have a couple to start with just in case.
We need the microphone. While the microphone gets to you, I'm going to start. Susie and Dr. Stockton, you've been integrating ACE screening and those types of discussion in the work you do, both at Hill Country and Shasta Community Health Center. Tell us what you're seeing and hearing from your clients and also the medical providers that you work with. You both have to answer if I can use both of them.
So at Hill Country, we have screened in the last 18 months about 10% of our patient population, and our average ACE score is about 5. We have implemented a number, about 6 complex care programs that help to wrap around additional nursing, case management, behavioral health, medical staff around different populations of patients that help to stabilize their lives a little bit. If you can imagine, you can't expect somebody's diabetes or hypertension to become under control if they don't have housing, if their mental health isn't stable. So those are the things that we've been focusing on in kind of our adult population. Our newest case management program, just started a couple months ago, is supporting transitional age youth who are homeless, who attend either Chiba or Shasta College to help wrap additional case management and housing support around that group of patients. And we really at Hill Country are trying to treat this at a multi-generational, in a multi-generational system, and a number of our behavioral health staff are trained as triple P, positive parenting partners, I believe is what triple P stands for. And so they're helping parents to develop good parenting skills to raise their children. Our providers, we talk about it a lot, so our providers are all very in tune to ACEs. We do lots of trauma-informed care trainings. So we've gone from, we talk in our provider meetings about not saying what's wrong with you, but what happened to you. It's reframing it just a little bit and makes it normalized to some extent.
Hi. Hi. At Shasta Community, we're kind of looking at this from a twofold approach. So I know our pediatrics department, which I don't routinely work with, is implementing this as part of their well child visits and actually working hard to identify those risk factors for kids and then connect those families with support services that are appropriate for their risk factors. I deal with it at the other end of the spectrum, so I work mainly at this point with adult patients and patients with chronic pain and complex health issues, as well as addiction issues. And the questions about your ACEs, your adverse childhood events, actually are really integral to the work we do. And I think it's a little bit surprising for patients sometimes when they come in to talk about their back pain and for a consult about their pain medications. And we ask about things like, what was your childhood like? What's your family history like? Were you a childhood victim of physical or sexual abuse? Those numbers are really, really high in both our patients with complex medical problems and chronic pain, as well as patients that we're treating for addiction. So that's where our focus is right now.
We had a question in the back, I think.
Oh, she actually answered my question. It was about how do we go about getting this part of the Well Child exam, and it sounds like they're already doing that. So, but and is it every single one, or do you have to start with small groups, or how do you get people to take this questionnaire? You know, and are they taking it for themselves? Are they taking it for their kids? Both? That's generally my question there.
Yeah, so I think that's different depending on what office or site you're implementing it at. I would say, though, that I think a lot of it is a stigma around, I can't ask those questions. People aren't going to answer that anyway, even if I do ask. And that has not been my experience. My experience when you talk to patients and people about this, that they're actually, I think, almost relieved. And when you have that conversation and say, it's not your fault, but we need to recognize that these things that happen to you impact your later health, your brain chemistry, the choices that you make, that a lot of times they're actually relieved to start that conversation and relieved to be able to talk about it openly. So I work mainly with adults, and I find almost no difficulty getting people to answer that. And I hear from our pediatricians, actually, that people are very open to answering those questions.
Yeah, I think you'd be surprised how much people are willing to talk. They'll tell you pretty much anything that you ask. We have implemented it in a very robust and strong way in our medication-assisted treatment program, and I think that it really helps our providers understand not only where the patients are today, but where they've come from, the support that they've grown up around, and knowing that you can't expect somebody to model and have responsible behavior if they've never been modeled that themselves. So that seems to have been a good starting point for us.
We have a question in the back over here, Kelly.
Hi. So I'm understanding that when adults come to the facility at Shasta Community, they will be asked these questions, and if somebody hasn't been, what would they do in order to facilitate that conversation?
So currently at Shasta Community, no. If you come as an adult for a routine visit, they're focusing mainly on pediatric patients. And then on the other end, we're focusing on it with adults with some of our more complex patient programs. But that's a good question, is where would you start? So 6 or 7 years ago, when I started noticing there was this trend among my patients with really poorly controlled health conditions and trying to figure out why that was and what you would do to help them, and I started kind of picking up on this story over and over again of neglect, of abuse, of addiction in their histories, and for me, it was kind of a relief when this research kind of finally made its way to our county and we started hearing a name for this. 6 or 7 years ago, I think if you talked to your doctor about this and said, you know, I'm worried about the impact that might have had on my health, your doctors would have looked at you blankly and said, I have no idea what you're talking about. But at this point, this information has been pretty well percolated among the medical community, and there's a lot more understanding and acceptance of it. So while your adult doctor probably won't bring this up with you because there are so many things they're supposed to address during that time, most of them should be relatively comfortable answering if you bring it up with them and helping you find access to resources and education that are appropriate for you. So ask. You can never go wrong with asking your doctor something, and most of them should be able to provide information about that at this point.
So just let me get some clarity, and it's not for myself, it's for somebody else. What would I advise them to do if they're in the situation where they've got multiple diagnoses, so to speak, and it seems like they're not getting the information that you're presenting to us today? What would their first step be? Just go to their medical doctor that they've been assigned there and say, hey, I think I've got ACEs issues, give me the test?
So you're asking specifically about an adult now who's
Yes.
sick and having health complications and
Yes.
and is going to Shasta Community or could go to
Yes.
Shasta Community.
Yeah.
So you could make contact with that a couple different ways. So our behavioral health department might be a good place to start, but you could actually just walk into your appointment with your primary care doctor and say, yes, I'm worried about the effect this is having on my health or on my health conditions, and they should be able to direct you to the appropriate place within the clinic to get help for that.
And then their next step would be?
After they show up for that initial appointment? It depends on the specific ACEs and the specific physical consequences of that. So we have, and I believe that Hill Country does as well, we have programs for case management support to help with kind of the functional skills of living. We have behavioral health support and counseling services that are available. We have certified drug and alcohol counselors, as well as medication-assisted therapies for opioid addiction, for alcohol addiction. We have HIV and hepatitis treatment, which can be consequences of that, and programs for people with poorly controlled diabetes and congestive heart failure. So it depends on the specifics, and I would be happy to stay afterwards and get a little more details and kind of steer you in the correct direction for that.
I think the other thing that you can have someone do if they're wanting to know their ACE score is to go to the website and have them take it themselves to see if that's helpful to them in some way, but also to attend a training around ACEs and what that really means to them and what that means to so they have more information too when they go to their doctor around what it is that they're really asking about. So that might be another avenue to take. I want to field one question for, I'm sorry, did you want to say something?
And I really want to keep directing people back to the ShastaStrongFamilies.org website. That is a Shasta website that's really about resources and information here in our county, and also with links for things nationally. But as you saw from the movie, Laura Porter and Dr. Anda are really taking the science to communities and talking about what to do about it. And we argue, argue's probably not strong. Argue was a word that would define probably the first 4 or 5 years of our collaborative. Our fear was that when we started sharing the data and started talking about our high ACE scores, that it would somehow, or if, for example, we started asking medical providers or family serving organizations to embed ACE screening into the work that they do, that all of a sudden we would have people have really horrendous mental health breakdowns, and we didn't have enough psychiatrists in town to deal with it. And what Dr. Anda learned through his study with Kaiser and what he shared with us in our community is, by the time you get to be an adult, you kind of lived with this for a while, and you know, but nobody asked you. And nobody gave you permission to talk about it, and nobody told you that it changed the way your brain was wired, the way your body was wired to respond, and that some of those things that have been struggles for you all of your life, not all, but some, have been rooted in you since childhood. And often, and that's why I say, watch the Annette video on the aha moment, just, you know, spoiler alert, she's got 10 ACEs, and she went to Dr. Anda's presentation. It's that aha moment when people are willing, in many cases, not all, on their own to reach out and take services that maybe have been offered before, but they didn't really understand the context of how it might help them. And parenting, new opportunities for new parents is another crucial time, right? Because most of us want to do better for our kids, and that seems to be a turning point. So the website's a good place to start. The training's a good place to start. Some people need some extra support from their physician. We have docs that are starting to build this into their practice. There's lots of ways people can deal individually with the science of the ACEs, so.
I think one really important thing to know is that it's not a cookie cutter solution. Everybody is going to be at different places in their personal lives, and so counseling might be right for somebody. We, both at Shasta Community and at Hill Country, one of the reasons we practice team-based care where we have a nurse and an LVN and a case manager and a provider and MAs on the team is because you're going to connect with somebody different on that team. So I think, know that it's not that, it's the goal is to meet somebody where they are, not force them to go to counseling, not force them to go into addiction treatment, that kind of thing.
Great information. I know we have a couple questions back there, but I want to make sure we get to one here that I want to make sure Judy gets to answer. We know that the Office Education has been working really hard at training all our teachers and the teachers throughout the community around trauma-informed practices with Dr. Perry, and Kelly Rizzi's done a lot of work around that. Can you kind of give us some information around how teachers are responding and students are responding and parents are responding?
Well, certainly both Kelly Rizzi and Stephanie Alexander are here from our office, and from the moment that Kelly first heard about this, it's been something that's penetrated the county. As we think about the impact on teachers and bus drivers and those who work in the cafeteria, anyone who touches the life of a child has had the opportunity to hear Kelly's message, and then we brought Stephanie on board because the response has been so great. You see young children who are struggling with behaviors, and now there's more to the story. It's not just about their behaviors, it's about trying to understand why. Why are they exhibiting the behaviors that they're exhibiting, and how can we better support students so that they don't stay in that stress response on high alert, but they are able to move to another part of their brain where they can think logically, they can learn, and they can really interact with their classmates and with others on a school campus. And teachers have been very receptive. Matter of fact, everyone on school campuses has been very receptive to the information, and that's why we now have 2 people who are doing a ton of work in that area across schools, not only in Shasta County, but even beyond. So we are honored to be part of this work and really see the impact that it has moving forward.
All right, I think we have a question back in the back.
Thank you. I'm so happy you were able to make this film complimentary so more people could show up. Can you hear me okay? Yeah, it's echoing a bit. Wendy and Terry, thank you so much. I wish we could have a whole lot more of the Miss Kendra. I love that letter writing. My question is to any of the 3 panelists regarding the test. As far as I know, I'm a trained clinician, and I believe all the questions are yes or no. Is that correct? There's for
Yes,
the
they are.
ACE exam? Okay, so here's the clarification. When there's so many other issues impacting a child's neurology, whether it's chemical toxicity, whether it's from the GMO glyphosates, or EMF, cell phone, 5G, iPads, all the devices that are surrounding kids more and more, or whether it's the geoengineering, the heavy metals, the vaccines, same thing. Kids are being vaccinated a couple hours old. Bear with me, I'm trying to list a lot of things that I would consider, and some other parents do,